Corneal ulcers just means that the epithelium is missing, plus or minus the stroma, or some portion of the stroma is missing. So superficial ulcers, only the epithelium is missing. So only those few cell layers on the surface are missing. So when you stain it, you just see a very, very shallow defect, versus a deep ulcer would mean that some of the stroma is also missing. So our stain uptake is going into those deeper layers. And the way that you can tell during your exam is if on your direct ophthalmoscope, use the slit beam setting. And if that little slit beam of light divots in or forms a little dimple, that is evidence of some of the stroma being missing from your corneal ulcer. So when we're talking about corneal wounds, especially superficial epithelial wounds, these should heal very quickly if there are no complicating factors. We usually do recommend topical antibiotics for prophylaxis to prevent infection. Pain management, often these superficial ulcers can be very painful, so topical atropine, oral NSAIDs to help with pain. But if this is a straightforward acute superficial ulcer, this should be healed within just a few days. So typically we'll recommend a recheck within 3 to 5 days of seeing a patient with an ulcer like this. If it doesn't heal, especially if you reach that 7-day time point, that's when we start to think about, why is it not healing? And one of the common pitfalls or things that I'll see patients that are referred to me, they'll have been placed on multiple antibiotics over a course of weeks. So they might be first seen and prescribed triple antibiotic and then rechecked a week later and the antibiotic is switched to something else, maybe gentamicin or tobramycin or even a fluoroquinolone. And the thought is maybe the ulcer isn't healing because I've chosen the wrong antibiotic. And I will say that that is not true. That's a misconception. If an ulcer is truly superficial and not complicated by infection or a variety of different things, simply switching topical antibiotics will not help the ulcer to heal.